Today we will discuss about the role of calcitropic hormones in the maintenance of calcium homeostasis. What are calcitropic hormones? These are three hormones. 1,2,5-dihydroxycholecalciferol, another name is activated vitamin D3 or calcitriol, parathormone secreted from parathyroid gland, and calcitonin secreted from thyroid gland. Okay, we shall discuss the role of each and every calcitropic hormone in detail here. So first of all, I will talk about the role of 1,2,5-dihydroxycholecalciferol. How does it affect the mechanism of calcium homeostasis? So it basically increases the plasma level of calcium and phosphate. How does it happen? How the absorption can be increased? By increasing the absorption from intestine. We had discussed this thing in the previous lecture that TRPV6 channels are involved in the absorption of calcium from duodenum. Secondly, it increases the proliferation of osteoblasts. So it increases plasma calcium levels and secondary activation of osteoclasts. So how the plasma calcium will be increased? If it will be more absorbed from the bone. Okay, process of bone resorption, taking the calcium from the bone and increasing the level inside the blood. Okay. Secondly, increases the renal reabsorption in the proximal tubules with the involvement of TRPV5 channels. So how would concentration of any substance can be increased in the blood? We can increase the absorption, we can reduce the excretion, and if anything is left, we can take it from the bone. So बोन से कैसे लेंगे? ऑस्टियोक्लास्ट का एक्टिवेशन बढ़ा देंगे. ऑस्टियोब्लास्ट ज़्यादा कैल्शियम देगा, क्लास्ट उसको निकाल लेगा. एब्जॉर्प्शन इंटेस्टाइन से करा लेंगे और रीनल से एक्सक्रीशन नहीं होने देंगे. वी वुड प्रिवेंट द एक्सक्रीशन rather than we will increase the absorption of calcium. Okay. Now about the role of parathormone. It increases the plasma calcium, but simultaneously it decreases phosphate. How does it happen? It increases resorption from bone, increases reabsorption of calcium from renal tubules. Okay, so you can see the difference. Resorption from the bone, resorbed. Reabsorption from renal tubules. Increases formation of 1,2,5-dihydroxycholecalciferol and it causes excretion of phosphate in the urine by the renal tubules. So you can see one contraindication. Parathormone decreases phosphate. 1,2,5-dihydroxycholecalciferol, it increases phosphate. Now we will talk about calcitonin as well. It decreases both. Plasma calcium is decreased, phosphate is also decreased. How does it happen? It opposes the process of bone resorption, inhibits the absorption of calcium and phosphate from gut, and promotes the excretion of calcium and phosphate through the kidneys. Okay. Thank you very much.